Hello, everyone. Okay, so this is the third time I have tried going live in the past 10 minutes, so hopefully we will keep our fingers crossed that this will work. But welcome to another episode of Specialty Spotlight. My name is Michelle, and I am a family nurse practitioner. I started Specialty Spotlight to really highlight the different areas that nurse practitioners are able to work in. So each episode, I get to chat with a nurse practitioner to learn more about their specialty and to have them answer any questions that I get from you guys regarding their specialty. So if you want to make sure that you stay in the loop, give me a follow on Instagram at the.mp.mom. All right, and so without further ado, this week we are talking about neuro-oncology, and I am going to go ahead and invite our guests in, and we'll keep our fingers crossed that this will work. All right, technology, come on, be my friend today and work. I hope everyone is having a great Saturday so far. All right, so I just got an error message saying that our guest cannot join us, but we will see if this works. Yay, you're on and you're
Okay.
moving.
I'm not gonna touch anything.
All right, I can hear and I can see you.
You can see me and I'm moving?
Yes, you are moving.
Okay, good.
Can you hear and see me?
I could hear and see you. We're good.
Okay, yay, we're good. I'm
Okay.
not gonna touch it. We won't touch anything. We'll
I'm
just
not gonna
go
touch
on
it.
with this.
Okay, good. Okay.
All right, so let's begin off with an introduction. So, will you tell our listener a little bit more about yourself and what made you decide to go into neuro-oncology?
Okay, first of all, I'm just really excited to be talking with you. I love following you. I love all your content. Um, so yeah, I am a nurse practitioner, have been one for about 16 plus years now. And I live in California, Orange County specifically. And I originally, so I'm actually a family nurse practitioner. That's where I got my certification, and I did it through the ANCC. Um, so it was a long time ago, maybe, yeah, so like 16 years ago. I don't know why I chose, but I just felt like that was more like clinical, I think. Yeah. And anyways, and I had an option actually to do oncology during grad school, but I never actually liked oncology and I never thought I would actually be in oncology. You know, I really like primary care.
Mm-hmm.
Um, so, I just had a long journey. I just did, I did primary care in the beginning. Um, and obviously, like, I was engaged, well, not obviously, but I was engaged when I was in grad school. And then as soon as I graduated, we got married. And then, we wanted children, so I needed something flexible. So, urgent care is just super flexible, I'm sure you know. So, I just did that for a while I was having my three children. Took about 10 years kind of total, like in and out. You need that flexibility,
Yeah.
right? So but I always wanted to do something more specialized.
Mm-hmm.
So like I said, I dabbled in aesthetic medicine. My husband and I, we were going to open a med spa
Oh,
a couple years back. So I got the certifications and I learned how to, do the lasers and the Botox. And I did work in like a med spa for about a year or two, I would say. Um, and then I changed my mind. I decided, I don't know, I just didn't know if that's what I wanted to just settle in, you know? Not
yeah.
that it's not good. I'm still interested, obviously. I still love skincare and all of that stuff, and I might do in the future, but I just didn't feel like that's what I wanted to like, settle into.
Yeah.
Um,
Well, I mean, that's the best part about being
yeah.
a nurse practitioner is you have all this flexibility. So,
Right, right. And then so when my third one was maybe, how old did he, 7 now? So when he was like 4, I felt like, okay, now I can kind of like, focus on my career a little bit more.
mhm,
And I wanted to specialize. Um, but because I didn't have like too much acute care experience, what have you, like, I applied to like, all these different, positions. And they were like, oh, you don't have experience. I'm like, obviously I don't have experience, right? So, how do you get in the door?
yeah,
It took a while, actually. I think for me, for my search to like get into a specialty,
mhm,
not that urgent care is not a specialty, but something more acute.
mhm,
I would say the journey took about like 3 years, like, applying and interviewing and all that stuff and finding a job that like I really liked.
mhm,
So I kind of like, I didn't have any neuro experience and any oncology experience, and I applied and not thinking I was going to get this job. But it kind of like fell into my lap, and I interviewed, and they liked me because I had a really strong medical background. That's why they said they hired me, because I had such a strong medical
mhm,
background. And I've been in neuro-oncology now for about 3+ years,
mhm.
and I love it. I didn't think I would like it. I was actually pretty apprehensive about taking this job. Like imposter syndrome after like what 13 years of being a nurse practitioner, you think like I wouldn't have that, but oh my God, no, I had a severe case, and I literally was like, I felt like I was kind of like in med school for like the first 6 months, because I kind of had to like learn everything.
Yeah,
I mean, like neuro and all the oncology stuff was like brand new to me. But I think I felt like I just really wanted a challenge and
yeah.
challenge myself, with my old brain. I don't know what I was thinking. I probably would have done better if I was younger, but it was really hard because I had to come home and, do all the kid stuff. And then, like, at night, I would actually study.
Uh-huh.
But it was really exciting. And I really love what I do right now.
That's awesome.
Yeah.
I'm so glad to hear that. So, full disclosure, okay, I do not know much about neuro-oncology besides like people with brain cancer will be
Yeah.
seen in neuro-oncology, and that's pretty much it. So can you tell us what a typical day or week may look like for you, and like what do you see? What kind of patients do you see in neuro-oncology?
Yeah, of course. So I'll start with like my typical day.
Uh-huh.
Um, so so we're like, not most hospitals have like inpatient neuro-oncology service. So what that means is we're always just consulted.
Mm-hmm.
So we're mainly outpatient based, but because where I work, we're attached to a hospital,
Mm-hmm.
we will round inpatient when our patients are in there or when there's a new brain tumor consult.
Oh, okay.
So like I'm half outpatient and half inpatient.
Oh, okay.
Yeah, currently there's 2 NPs in our practice, and we have a fellow. So we kind of take turns, but for the most part, since I was new, I was a primary like inpatient NP. So then in the beginning, I'd have to kind of just, see who's there,
Mm-hmm.
check, make sure all their vital signs have been stable that day before, and then make sure, their labs are okay, and just kind of round on them, making sure it's basically like I do like the neuro exams, like, most of them are post-operative, like after like a brain tumor resection.
Okay.
Um, so sometimes, I do it neuro exams and just kind of checking up on them inpatient. Um, Oh, she's let's see, June, how many patients do you see per day? It varies. So it depends on how many patients we have in the hospital. Sometimes we'll have like 4, and sometimes we'll have like 20. And
Wow.
so we don't always see everybody every day, but especially if they've had MRIs or there's been a neurological change, we would see them that day. And that was like mostly like half of my day. And then I'll come back and then help out in clinic, because we have like a full clinic, which are like patients who are currently, on chemotherapy, or, we're just long-term monitoring.
Okay.
So that's kind of like my day. The
So
thing
then,
that, yeah.
I was gonna say, so then it sounds like do you like do rounds in the hospital like in the morning and then in the
Mhm.
afternoon is like outpatient clinic time.
Yeah, pretty much if I'm the one rounding on the inpatient, then I'll try to do it early on. And then
Mm-hmm.
I try to finish maybe like by 10. And then I come back and chart maybe for like an hour. And then I'll just jump in and help out in clinic.
Oh, okay. Okay. Do you do this like every day then that you are working where you'll round on patients in the morning and then go back and do clinic work in the afternoon?
Yes. So unless we're like super busy in the clinic, sometimes we're so busy. Hi, everybody. And then I'll have time to go inpatient. But if, like I said, if we're busy like in the clinic and they're like, okay, we need you, then I'll sometimes just stay and maybe just do like new consults in the hospital.
Oh, okay. Okay. What's your work schedule like? Do you work a traditional like Monday through Friday?
Yeah, so that was, it was important for me to have like a work-life balance because I made it clear that, my priority is my family.
Mm-hmm.
I'm like 16 years in. I have three kids. I'm not, my family is my priority. So,
For
um,
sure.
it's Monday through Friday, and it's like a 9 to 5 work schedule. So that works really well with me because my husband's he's a business owner. He's self-employed. So, that works for us.
Okay, well, that's awesome. So, since you've been in neuro-oncology for like 3+ years now, and this opportunity kind of fell into your lap, what is the thing or things that have surprised you the most about neuro-oncology?
Oh, I wrote this down because I was gonna forget. Let's see. The surprising. Oh, the thing that surprised me actually is I was really fearful actually starting out because the question that our director when she was hiring me, she asked me if I'm comfortable with talking about like death and dying.
Okay.
And honestly, I was like, I kind of lied through my teeth. I said, yeah, sure, I'm comfortable, but I was really not comfortable.
Uh-huh.
Um, but I was surprised at how comfortable, like it sounds weird, but I got comfortable talking about dying and death and realizing that it's not like so tragic. It
Mm-hmm.
can actually be done in like a beautiful way because it really, if you're talking about death and dying, then you're actually talking about like how you want to live, right?
Mm-hmm.
Yeah, and so that was surprising to me. And I think I was just surprised at how much I would like really like working here.
Mm-hmm.
To me it's like I love my patients. I don't it just I mean we all like love our patients,
Yeah.
but my patients are just really special because I feel yeah, I don't want to say I sympathize, but it's like it's just they're just special. So I was just surprised at how much I enjoy neuro-oncology.
Well, June, I have to say, like, I'm sure your patients love you, and I have to share a story with everyone that's watching. So it turns out that I made a connection with someone, and that person's family member actually saw you as their provider, and that person had wonderful things to say about you. And I
Oh wow.
why wouldn't they? Like, so you guys, I've known June for like what, a year now? I think a little over a year.
Yeah.
She has been amazing. I've never met her in real life before, but I feel like she's one of my best friends and I can vent and say whatever I want to her without any judgment. So I love that about you.
Oh, thank you, sweetie. I feel the same way about you. We've never met like in person, but I just feel so like we have so much in common and
Yes, I feel like
yeah.
right now I'm going pretty much the same path as you are,
Yeah.
with like primary care and urgent care. And who knows, I might end up in aesthetic next and then maybe neuro-oncology too.
Maybe come join our practice.
So yeah. And
Yeah.
BB Pink 88 says, I'm not surprised that they loved you. Yeah, I'm not surprised either. Anyone who has spent, just a little bit of time getting to know you or even talking to you fall in love with you. And your content on Instagram, I love it because it's all about empowerment and just being true to you. So I love your content too, June. You're
Oh,
awesome.
Thank you.
All right. Since we're kind of on the topic of like, death and talking about death, and things like that, I've actually got a question from a high school student who is really interested in going into the medical field, but she's very worried about like dealing with death and, how to react like around the family, how to cope with it. Would you have any advice for her?
Oh, yes. I wish I had some coaching prior to starting neuro-oncology. I just kind of had to like shadow some of the physicians and see how they converse with the patients when we're talking. Because basically, our patients come in like, a week ago they were perfectly fine, and then all of a sudden we're telling them they have this malignant, aggressive, brain tumor that basically they have like a year to live, right? So that conversation is really hard, and unfortunately I don't have that conversation with them, but the physicians do. So I went in the room and kind of like listened in on how they approach it, and it
Mhm.
could be done in like a very sensitive way. So I guess to answer that question, to just be comfortable in the family, it's like I don't know, to me I don't have like an exact answer, but the way I approach it is I actually try to see my patients and my family, I mean, their family as like my family. Like, how would I want my family to be treated
Mhm.
if, given this situation where we have to talk about like the end before we're
Mhm.
talking about treatment? Because we do have to talk about the end. I mean, not that all my patients are, have that like life, overall survival rate, but
Mhm.
um, like the majority of my patients do have like a limited time. And so
Mhm.
we have to talk about the end and kind of be clear on that
Yeah.
before we talk about how we're going to treat it.
Yeah.
Uh, so we do talk, most of my patients, we have this conversation. And I approach it as if I was talking to my family. I honestly, that sounds cliche, but that's the only way that I can do it. And
Mhm.
I try to be sensitive, and be compassionate, but I'm actually very direct, and I do tell them what to expect. I used to think that like I have to kind of beat around the bush,
Yeah.
and not be direct because it can sound kind of harsh.
Mhm.
But I think it's important for like, them to know what to expect, um, so that they kind of know what to face, you know? And I think it takes courage on everyone's part to kind of face it, realistically, because to me, the thing that it hurts to me the most is when I see the regret, right?
Yeah.
Like, I wish I could have done this. I wish I could have said this. I wish I could have like done more of this.
Mhm.
So I, I'm not like, I'm gentle, but it's direct.
Okay. And I think that's
And
always such a good approach is just
yeah,
being direct and letting people know. And then I also think too is anytime you are kind of like new at approaching, the situation that involves death, like you shouldn't be by yourself. Like, if this is your first couple of experience, I feel like, you should always go with someone who has more experience. That way, if they feel like you're struggling a little bit, they can kind of like jump in and help out a little bit.
yeah.
Yeah. All right. Well then, since you love this neuro-oncology, what would you say, is your favorite thing about neuro-oncology?
My favorite thing about neuro-oncology, honestly, is that there's always something more to learn.
Mm-hmm.
Um, I've been in neuro-oncology for 3 years now. And like we have a fellow, and fellow is like they've done the residency, and they're just learning more about this specialty. But there's still so much to learn about neuro-oncology. People think that because it's super specialized, like it's cancer and then it's just brain, but the brain is so complex.
Yeah.
I feel like I'm learning something like every day about the brain, about how the brain works. And I love that there's currently a lot of research that we're involved
Mm-hmm.
in our department, because unfortunately there's not a lot of cures and there's not a lot of medication right now. But our director is really strong on research, and she's really involved like nationwide, actually worldwide, like research on finding better treatment and cures for our patients. So, and the fact that I'm involved in all like the clinical research part of it is actually really exciting. I love that part.
That's so cool. So you are, so you're where you work at, you guys are involved in clinical research for like different
Mhm.
options.
Yeah, we have a lot of clinical trials where we are um, that I'm actually like actually actively involved in. So that's pretty exciting. That I feel
That
like,
is awesome. Like,
yeah.
not only do you go into this area of specialty to learn something new as a provider, but you also gain kind of like a different set of skills in terms of like the clinical research side.
Mm-hmm. Yeah.
So, coming from my background, because I'm still in urgent care, and sometimes it can be very procedure intense. In neuro-oncology, do you guys get to do any type of procedures or do you mainly see patients?
So that's the one thing that I kind of miss, honestly. I did urgent care, primary care for like what 10 plus years.
Mhm.
Um, and like the pap smears and all like the INDs, I was complaining about it, like they were getting tedious. But I miss doing like all of those, so enjoy those. Um, but I do there are some procedures that we do, like we do like intrathecal chemotherapy, which is pretty intense. Patients have like basically it's like a like a chemo port or like a port, but it's like in their like scalp, and there's like a catheter that goes into the ventricles, and we basically just inject like chemotherapy directly into the CSF. And so I learned how to do that. That was just like on the job training. And then we do like lumbar punctures, which when they first hired me, they were short staffed, so we were busy. So I didn't really like have a chance to learn that. So I'm actually going to start learning how to do LPs. Um, and sometimes, I'll do like wound stuff because, some of our patients have wounds. And so
Mm-hmm.
unofficially, like I'll do wounds. But, I wanted to like, I was excited to come on here because I wanted people to know that like, you don't have to like start this perfect path.
Mm-hmm.
Like I feel like ideally I should have done maybe like acute care NP and like gone into like, or oncology or whatever right away, and that's like the only way. No, like I literally just did like so much, I just did like all like I dabbled in different things, and like in this, I had like I moved like 6 or 7 times basically. So, you don't have to stay in one place, you know what I mean?
Mm-hmm.
Um, and I feel like all the experience that I got, like that's coming out now. Like all of my just assessment skills and just all like the medication that I know, like I'm actually using it right now, in neuro-oncology because my patients, because of the medications they're on and how it's a lot of them are like they suppress like their bone marrow, so they have like low platelets and just whatever they and all the stuff that's going on with their body. Like I still need to know how to treat a UTI, like your eyes, like all of these things that I've done, I'm still doing it.
Yeah, yeah. Last week on our specialty spotlight episode, I was talking to Crystal, who also works in urgent care, but
Yeah.
I was telling her, my nursing background was in the OR,
Uh-huh.
and and then I went into primary care, and before going to primary care, I was like, I probably won't make it in primary care because in the OR, it's a very specific set of skills that and it has to do more with like surgery and the instruments that are used there. And you don't really learn about like, blood pressure management or even like
Right.
the common cold and stuff. And so I didn't think I was going to bring a lot of that experience over to primary care, but I was very surprised what I learned in the OR, just, what goes into having this that goes into having surgery, and how patients feel. And just being there, I was able to kind of like put these patients more at ease and answer any questions that they have. And I felt like some of my other colleagues who didn't have that experience, they were kind of like missing out on that. So yeah, I think whatever area that you're in, you can always bring that to a completely different area and you'll see it coming out.
Yeah, absolutely.
All right. Well, since you've told us kind of like what you love about neuro-oncology, what is something that you don't like? What do you not like about neuro-oncology?
Oh, what did I write? Oh, okay. Okay, so what I like and don't like are kind of the same. Meaning, like, okay, the thing that is hardest for me being a neuro-oncology NP is
Hmm.
just with my personality, like I can't do my job without putting myself out there, right? Like I
Oh,
can't do it well. And
mhm.
so what it means is I get attached to my patients and their families.
Oh
And so
yeah.
the thing that I really like rough for me, like on a week to week basis, is like that I have to say goodbye so soon. I mean, I hate to get super, tragic, like, but it's like a lot of my patients, I meet them and then I have to say them fairly, short term, like maybe like a year, two. So these are people that I see like on a weekly basis, and they kind of become like an extended family.
Yeah.
So that's the part that's pretty rough for me as a just who I am. You know,
Hmm.
I had to actually really learn. I mean, you could see through my posts, like really just posting what I go through. You know, the grieving process. Like I had to learn how to grieve people that like are not my family. Like but I can't really reach out to them. You know what I
Yeah.
mean? Like the
Yeah.
goodbye is so like not not like a clean goodbye.
Yeah.
So like saying not even just the patient, but like this family members that I've like been seeing every time with the patient, we converse, we like get to know each other, so saying goodbye to that, and then that's just the hardest part for me. But
Yeah.
I want that to dissuade anyone if they're thinking about, going to neuro-oncology, because it's hard, but yeah, that's kind of like the beauty of it. It's really taught me a lot about how to like live my life in the best possible, like trying not to live with regret. And
Yeah.
that's just been like a big lesson for me. And
Hmm.
I feel thankful. I mean, I know like cancer patients hate saying like, I'm glad you learned something from my tragedy. But just working in this field is just taught me that like you really have to just live every day like to the
To the
fullest.
fullest. Yeah.
Yeah. So every time I see my patients, I talk to them as if like I'm not gonna see them again, meaning like all when I see them.
Yeah. Yeah. So, with your line of work, because you sometimes unfortunately can see tragedy, back to back to back. What do you do for self-care? How do you deal with it? How do you process it?
I process it by I don't know. I think I process it actually through creativity to
Hmm.
say. Like I feel like I got really active on social media like in the last year. Actually, that was probably an act of my grief process.
Okay.
Because through my creativity, I'm able to express myself. And
Hmm.
express myself, there's a little bit of a relief. Um, and obviously, like I cry in the car, like sometimes, like when I'm driving, about them. But before I would think, why am I crying? Like these are not like my real family members. You know what I mean? And
Yeah.
but my husband was all like, it's okay. You should just like really like sit and just get through it.
Oh, that's so sweet. I love that. I love how he was like, it's okay, like just cry.
No, because I was kind of ashamed, like he's gonna judge me and think I'm weird that I'm crying for these strangers, essentially, right? But then
Yeah.
he knows me that like I get attached. So he's like, just process it and just think about all the good things and that it was an honor to be part of their lives. And I'm like, oh, that's really good. So I do that. Like sometimes my drive to and from work, I'll
Hmm.
think of a patient who I've gotten to know, and
Hmm.
then I'll just think about the times that we shared, and I'll just cry, and then I'll kind of like not get over it, but I don't like it's not so difficult. You know
Yeah.
what I mean? I
Yeah.
really think that's essential actually for coworkers, because even though like you're not dealing with like death and dying so in your face, like we deal with grief,
A lot.
right? And right, especially right now with COVID, I feel like it's an essential skill that like we were never taught in school, like grade school or college or grad school, it's never really taught how to process your grief and emotions. Uh,
Yeah.
I think it's really essential. And I feel like just working here, I just learn. And I feel like it's been really good for me just in my own life, learning to
Mhm.
process grief. But um, yoga is another thing. I love yoga and just spending time with my family. That's just how I decompress.
Okay, that's awesome. Yeah, no, I definitely do agree with you. I feel that in school, we never really learn how to deal with our own grief. Like we learn how to identify like the different stages of grief. But I think too, a lot of people in our field, it's easier for us to identify other people who are going through it. But when you're going through it, you make excuses for yourself. Like, I'm not really feeling this way because of this. And so you kind of like neglect it until it gets really bad. And that causes a lot of problems. But yeah, I definitely do agree with you about that. For people that are interested in neuro-oncology, and I know that you've been giving a lot of like tips on, how to get into it. But yeah, what advice would you have if, someone specifically is like, I really am interested in the brain. I really want to work with cancer patients. What advice would you have for them who, maybe fresh out of school, like they know they want to do neuro-oncology?
Oh, like fresh out of like school NP students?
Yes, like NP students, yeah.
So, honestly, I think as a new grad, I don't think neuro-oncology is, a good place to start, I have to say. Because
Okay.
it's so specialized, I think you do need like a good base of knowledge in terms of just like a physical assessment, and like medication knowledge. And actually, I don't think they hire like NP1 or I don't know whatever else they graded. I was actually hired as like NP3 because I had like 10 plus years of experience.
Mm-hmm.
Um, my advice would be, I feel like most people do like family, right?
Mm-hmm.
But I think my advice would just be like, whatever you do, start on family, like just learn as much as you can and obtain as much skills and be really on point with like your neuro exam.
Mm-hmm.
Um, and just kind of like dive into whatever you're doing now. And then if you want to specialize, because that was my thing. It wasn't that I was like wanting to go into neuro-oncology. I wanted to specialize. And so I just kept going for it. I wasn't necessarily qualified with all of these places that I was, applying for, but I
Mm-hmm.
still went for it. I still like, shot my shot, right?
Yeah.
Eventually, like something good landed, and I feel really blessed that I got this job. Um, so I think you just have to just keep trying,
Okay.
Yeah.
Keep trying. Start off in a general area.
Mhm.
Just because with, being a nurse practitioner, there's different certification that you can get. We're both family nurse practitioner. Um, Would you recommend that, getting a family nurse practitioner degree is sufficient to work in neuro-oncology, or would you recommend more like adult geriatric nurse practitioner or acute care nurse practitioner? Like, what would you recommend?
I think probably, do they still have like oncology course track in school?
I feel like I don't think so. I think it's I looked this up recently, so
Oh,
I
okay.
know. But yeah, I think there's like acute care, there's adult geriatric, there's family. I mean, there's like peds and neonatal. And then in terms of specialty, I know that there's like an emergency
Oh,
room nurse practitioner, but I
okay.
don't think there's like an oncology nurse practitioner
I
track.
see. How old I am. Because when well, they had that track. I think,
Really,
I,
they used to have oncology nurse practitioner?
yeah, they did.
Oh wow, I didn't know that.
Yeah. So I think family actually is okay. Initially, I thought acute care would be better, because you're like in the hospital learning
Mhm.
procedures. But honestly, I think family is sufficient because
Okay.
you
Do
learn.
you do you see kids in neuro-oncology, or what's the age range that you see in there?
So we are adult, but because if they're peds, then they'll go to like the children's hospital.
Oh, okay, that makes sense.
Yeah. But we have seen a couple like 14, 16-year olds just like on a special basis.
Mm-hmm.
Yeah. But that's not like ours is adult because it's
Okay.
a totally different field. Yeah.
Okay. Yeah, that makes sense. So 14, that's probably the youngest patient that you've seen.
Mm-hmm.
Okay. And then again, I'm learning so much about neuro-oncology talking to you. What pearls would you share with us about your specialty? Like, yeah.
Okay, so I was thinking about this. I think the pearls I would recommend is, well, the things that I wish I learned before I got into neuro-oncology is I really wish I was better at my neuro exam.
Okay.
Because in urgent care or in primary care, I mean, you do it, right? But how do you do it like thoroughly? Probably not, right? Like not like the CN2 to 12, like, and like that, right?
Yeah.
There's so much involved in the neuro exam. I would definitely brush up on the neuro exam and just practice on like your family or your spouse or whatever, because I literally do a thorough neuro exam on every patient every time I see them.
Okay.
Yeah, and it's like I just takes me like maybe like about 10, like 5, 10 minutes,
Oh, wow.
but
That's a
that's
very thorough exam
yeah.
then.
I do a complete neuro exam, and you have to know, like, you have to be very good at see like the slight changes.
Mm-hmm.
So that's one pearl. The second pearl I'd recommend is kind of, if you're really interested in neuro-oncology, is to really study the brain in terms of like, I mean, there's so much to learn,
Mm-hmm.
but I think I just knew like what part of the brain is responsible for what action, you know.
Mm-hmm.
That's really, it's a lot, but it's actually something you can kind of learn, right?
Mm-hmm.
So that's super helpful. And then the third thing, what did I say? The third thing I think, the third thing is the things that like I'm always assessing my patients for is increased intracranial like pressure due to either the tumor growth or what we call like cerebral edema, when it's just brain swelling due to whatever reason, whether it's chemotherapy or their tumor is growing or something else is going on or bleeding. It all increases the pressure inside the brain because there's only so much space for it to go, right? Because of the
Mm-hmm.
cell. So when the pressure increases, then a lot of bad things can happen. You know, there's nowhere for the brain to go but down, right? So you herniate, and so that you'll become paralyzed or die. So we have to kind of be aware of the signs and symptoms. Like, they're broad, but they're pretty specific. Like, headaches, like new headaches all of a sudden, like severe headaches, vision changes, like blurriness, double vision. I ask these questions like every time I see my patients. Seizure activity, like new seizure activity, or like persistent, or not being controlled by their medications, or like sudden weakness on one side of their body, like difficulty talking or just confusion. These are all kind of signs of like increased intracranial pressure. Yeah, and nausea and vomiting also, and confusion. Those are the big things that I always ask my patients, and obviously like the family member if they're like they have aphasia or they're confused. So those are like the three things that I think you have to really be like on it.
That's great.
Yeah.
Yeah. I mean, I think from our conversation today, the things that I've learned is really like how in-depth a neuro exam could be. Because here in urgent care, when I do a neuro exam, I mean, it's probably like a minute, maybe two. And just to hear that when you do like a neuro exam, it takes like 5 to 10 minutes. That's, to me anyways, is very in-depth.
Yeah.
Yeah. All right. Well, let me just check really quick to see if we have any other questions here from our audience before we wrap up today. Dun, dun. And then let's see. BB Pink 88 wants to know, what about shopping? Do you do that as self-care?
Absolutely. Yes, I do. I buy tons of skincare.
I know. I see your stories and like, I mean, I love your skin. You have amazing skin. And I'm like, wow, that's awesome.
That's like my obsession.
Skincare.
Yeah, I just buy a ton of skincare and I hide it in my closet. Don't tell my husband, and then I give it away as gifts to like all my friends, and they love
Oh,
it. Love it.
that
Yeah.
is so sweet. All right, June, I think we hit all the questions that I wanted to get to today. Thank you so much for joining me today. I love talking to you, and I feel like anytime I talk to you, I can talk to you for hours and hours, and
Right? Yeah.
it just goes by super fast.
Yeah, it just flew by, and I feel like I don't know. I hope I answered all your questions. I know we kind of like went off topic a little bit, but
No, I think we did. And for anyone that's watching, if you have any questions about neuro-oncology at all, definitely give June a follow. Her Instagram is dot or at npjune, and I'll tag her in this somehow. I've been having some technology issue, obviously, from today, but I'll be sure to tag you in it and definitely give her a follow if you haven't done already. She has amazing content that will empower you and make you feel like you're the shit because that's what she does. All right, June, it was good talking to you. I will talk to you. I will talk to you again soon, okay?
okay, it was good
All
talking to you.
right.
Well, have a
Take
good day.
care.
Bye.
Bye.